Health experts say 40% of the global population has received at least one dose of a COVID-19 vaccine. While distribution has been moving quickly in richer nations, efforts have been slow in poorer countries. Less than 2% of people in low-income countries have gotten at least one shot. The U.S. has donated and shipped vaccines to dozens of countries trying to stop the global spread of the virus and support vaccine equity. For more on this, I want to bring in Jeremy Conondike. He is the Executive Director of the U.S. Agency for International Development's COVID-19 Task Force. Jeremy, thanks so much for being here. So explain to us why global vaccine equity is absolutely essential to fighting and ultimately ending this pandemic for viewers here in the United States as well as everywhere.
Well, I think it's exactly what we're seeing and what you referenced in the last clip there. The Delta variant has eroded some of the progress we've made here at home and in other countries, even with high vaccination rates. And so, what we see is that the longer that this outbreak, this pandemic rages overseas, the more chances it has to evolve more and more dangerous variants. And each of these variants has been more dangerous, more transmissible than the last one. So we run a risk the longer that this continues to burn overseas.
So tell us, Jeremy, we've heard a lot of pledges. How many vaccine doses has the U.S. actually shipped abroad so far?
So the U.S. At this point has shipped more than 130 million doses to more than 90 countries. That's a number that's continuing to grow. We have also organized a major donation of 500 million doses to the COVAX platform. That's the global collaboration to supply vaccines to low-income countries free of charge. And we expect that the first 200 million of those will be distributed overseas by the end of the year, and the additional 300 million in the first half of next year.
So you mentioned working with COVAX to distribute these vaccines. Tell us, what have been some of the challenges that USAID has faced in trying to move the shots?
Well, it's not an easy thing to roll out a global vaccine effort. We've never really tried as a world to do something like this before. Think back to major vaccine efforts like polio, like smallpox. Those were much longer term battles lasting for, in the case of polio, still many decades. So we're trying to do something like that now on a very compressed timeline with brand new vaccines. It's a logistical as well as a regulatory and a legal and commercial challenge, a production challenge, unlike anything the world's ever seen. In a normal year prior to the pandemic, the world would produce about 5 billion doses of vaccines, of all kinds of vaccines altogether. What we now need to do with COVID, if we want to hit 70% of the world, we would need to produce an additional 11 billion vaccines on top of the 5 billion we normally do. So, you get a sense of the infrastructure that existed before and the degree to which that production has to expand in order to reach global coverage targets.
11 billion is nothing to balk at. In some wealthy countries, though, I want to ask you about this conversation shifting towards potential booster shots. We've heard a debate about whether or not that is in the best interest in the global fight against the pandemic. Does it make it more difficult to get doses to poorer nations when many of the wealthy nations are now starting to give a third round or are discussing that?
Well, the president's been clear that he sees this as a both-and situation. So, our Pfizer contribution will not be slowed. That 500 million doses will not be slowed at all by the domestic decision to distribute booster doses. And and we have a worsening pandemic here in the United States again due to the Delta variant. So we do need to make sure that as we're fighting this overseas, we're also continuing to protect Americans. I think it comes down in part to making sure that we continue to expand the production infrastructure so that we can just be pumping out more and more doses every month. And there's some encouraging things happening into the fall on that. There will be some new production capacity that the United States has supported in India that will be coming online in the fall. There was an announcement just earlier this week of an additional nearly $3 billion that the administration is putting into expanding the vaccine production infrastructure here in the United States. So, we are trying, while we are doing everything we can to protect people domestically and to also scale up the availability of supply overseas.
I wonder, Jeremy, because obviously here in the United States, the donations, the pledges that we've made to the COVAX effort, to the international fight against the pandemic, has been celebrated. How does the rest of the world, particularly many of those poorer nations, feel? Do they feel like the U.S. is doing enough? And what is the U.S. doing to try and leverage our power to encourage other countries to donate more vaccines?
Yeah, I mean, we are hoping to see other countries do more. At this point, the doses that we've donated, the 130 million that I referenced, that is more dose donations at this point than all other countries combined. So, we're glad of the leadership that we're showing, but we really are hoping, and we are urging other countries to do more. Again, it does come down partly to supply. The supply projections we'd seen for some vaccines have been slower to be realized than we'd hoped. Pfizer is doing very well on production. Moderna's been doing well. Some of the others have been slower to hit the sort of targets they'd hoped to, and that has slowed the overall effort. We're hoping to see that corner turn somewhat in the fall and more supply become available, and that should enable the world to start catching up on some of those targets.
All right. Jeremy Conondike, thank you so much for joining in. Thank you for what you do.
My pleasure. Thank you.